An incompetent cervix is a cervix that just won't stay shut and retain a pregnancy, and a woman is classically given the diagnosis of incompetent cervix if she has multiple recurrent losses in the second trimester in the absence of labor or pain. And it's so unfortunate when this happens. And you mentioned that you might possibly have an incompetent cervix, and they're going to do more testing and watch you very closely, and that's good that they're keeping a close watch on you. You asked a good question. How often do they do a cerclage and put you on bed rest and see what happens? There's not an easy way to answer this. There's not like a percentage, because every case is so different. And this is a good question for your doctor. You mentioned you weren't able to ask at your last appointment, but call their office and see if they'd be willing to chat with you before you have your next appointment. They can tell you what their intentions are based on the circumstances in your situation. There's great risk with a cerclage because it's kind of like a purse string stitch that's placed in the cervix and it pulls it shut. And in most cases, this holds everything closed until you get far enough along in pregnancy where the doctor can remove the stitch. And then if you go into labor shortly after, then it would be okay. When doing this procedure, though, for one, it usually requires general anesthesia. That's always a risk. But the biggest risk to the pregnancy is that in placing the cerclage, they could poke the amniotic membrane and rupture the membranes. And infection is always a risk, too. So the benefits have to far outweigh the risk. Even though the risk is great, it means that the situation has to be pretty severe and intense for them to want to try a cerclage. In most cases, these are called rescue cerclages, where they're done in a pregnancy with no prior history of loss. Now, sometimes they do like a preventative cerclage, meaning that it's put in place around 12 to 14 weeks gestation to prevent a woman from having complications when they know in the past she's had at least 2 pregnancy losses in the second trimester and meets other criteria, which again makes it so that the benefits outweigh the risk. So again, your doctor will be able to give you the best information about what they intend on doing for you during your pregnancy. I hope the very, very best for you, and if I can answer any other questions for you in the future, please feel free to ask them on our Facebook page.